Thank you for logging in today for a demonstration of our claims auditing tool, RX Scriptlytics. I am Renata Jones, a pharmacist and business development director for Pharmacy Synergistics Incorporated. When I ended my tenure early 2017 as the Medicare Part D program director for a local Blues plan, I teamed up with other pharmacists and software engineers to develop some of the tools that you're actually going to be able to see today. Robert Curry, he is our lead software engineer who usually joins us for our live demonstrations. However, he will not be here today during the recorded version for website purposes. If you have attended one of our live sessions in the past and came back today for a refresher, we want to thank you and we welcome you back. However, if this is your first time viewing the demo, welcome. Our agenda is going to walk us through a few slides that demonstrate how Pharmacy Synergistics came about, who we are and our experiences, what happens behind the scenes for the tool, and a view into the client portal showing actual audit results. The slides and demonstration will take about 20 to 30 minutes, and if you have any questions at the end, please feel free to send them to me in an email at rjones@pharmacysyn.com. And you can also reach us at our website at www.pharmacysyn.com. This will also be on the very last slide of the presentation. The Pharmacy Synergistics team consists of pharmacists and technicians with a myriad of experience across managed care, retail, hospital, and long-term care settings. We incorporate software engineers that are the brains behind the infrastructure for all of our software tools. We as a business seek to offer solutions that can help support health plans, consultants, brokers, and employer groups. These solutions range from claims auditing for Medicare and/or commercial claims, as we will demonstrate today, as well as RFP support and custom programming solutions. Our experience is vast, ranging from government, Medicare, Medicaid business to different levels of pharmacy practice and IT experiences. We strive to utilize our years of experience to maximize efficiency, mitigate risk, and reduce costs with our varied software solutions. Claims auditing, formulary costs, and utilization analysis, and so forth, as you can see on this slide. Our website has additional information again about these services, and we urge you to go to our website. Feel free to reach out to us for a demonstration of the other modules or additional one-on-one information about any of the services that we provide. We're all pretty familiar with these headlines of how CMS is imposing more and more fines around plans with formulary administration errors, CDAG, transition, and other compliance issues. We here at Pharmacy Syn seek to help clients to avoid being in these headlines by utilizing our RX Scriptlytics software solution. Here is an overview of how the claims auditing tool will actually work. So what happens is during step 1, we have a claims data intake. The files that we would need from the plan or in order to run the module is your rejected and paid claims file, eligibility, formulary, and your pharmacy network file. And step 2 is actually the claims review. So these files are placed into RX Scriptlytics where proprietary algorithms are ran. The process will actually do a daily review of all utilization management claims, a daily review for all transition of care benefit module claims, and not only does the tool validate whether it appropriately adjudicated claims, but also inappropriately adjudicated claims. In step 3, we do the client interactive website posting. So instead of bombarding your email with any issues that may arise, we actually do it by an integrated data solution known as our client interactive. The client interactive website allows us to publish any results that we get from the actual tool. So if we find an issue with your claims auditing, you will actually be able to log into your client interactive website and see everything that we have done at Pharmacy Synergistics. It is also a housing for your monthly, quarterly, yearly reports and invoices. What you will see later in the demonstration when we go into the client interactive website is that it is an integrated data solution. That means we're not just pushing data to you, but you're actually able to respond to us and load files through that site as well. And then step 4 is reporting. So whatever we do as a service to the client will have official reporting. So you have preliminary issues report of any potential findings that we may find on a daily or weekly basis. Then you have your monthly, quarterly, and annual reports that you may need to report up to your boards or your delegation oversight committees. And then we also have a template for your CMS pre-audit issue summary for Part D plans that we'll also see later in the demonstration. What we're going to go over next is basically high level of how the tool actually works. So for the rejected claims audit process, these are the 4 files: your eligibility, pharmacy network, rejected claims, and formulary. They are all fed into the RX Scriptlytics module. The algorithms that are ran would be to test non-formulary, prior authorization, quantity limits, step therapy, and pharmacy network. The back-end process, the filters are applied, the technician will select claims for further review, and then if there are any that you have to review, then it goes to your website for final publication. Paid claims audit process, some of the same files, but instead of having rejected claims file, you're going to have a paid claims that go into the RX Scriptlytics tools. And what we're going to make sure is if all those utilization management edits that you have in place, that they were not circumvented at point of sale inappropriately. Transition claims audit process. Again, you have the same files that we've used previously, but this time there's a new file that's entered, which is the formulary change year-over-year file. So as we get ready to enter into the year of 2019, whatever negative formulary changes that you're making from 2018 to 2019, we know that those members, if they get a fill during their transition period, are actually supposed to get a temporary supply. So what this module actually does is it uses that formulary change year-over-year file to see which claims reject during that transition period for your current members that actually should have been able to receive a transition fill. The algorithms that are run will be ran for current members as well as new members, and again, those same utilization management edits of non-formulary, prior authorization, quantity limits, and step therapy. Here what we're going to go over is the actual testing scenarios. Here's a high-level highlight of some of the claims auditing that the tool will actually review for. This is not all-inclusive, but it will hit the highlights. We have upwards of 80 different scenarios across the claims auditing modules. So here what you'll see is for rejected claims analysis, when we get into the actual results, you will see claims that rejected for prior authorization required, the drug was not on the formulary, or the quantity that the member tried to receive exceeded the quantity that the plan would allow. And you can see these with and without a PA in place. Reject for B versus D, hospice members, brand drug is non-formulary, but the generic is on the formulary. And so a claim comes through for the brand with and without a PA in place, as well as our pharmacy network in versus out. So for the rejected claims analysis, if you have a pharmacy network in place where you have some pharmacies in and some that are not, you'll actually see whether or not these claims rejected appropriately at the out-of-network pharmacy. For paid claims analysis, we're looking for paid claims for drugs with no utilization management edit restriction in place, paid claims for drugs with a utilization management restriction and no PA in place, those that have a restriction and has a PA in place, and then your pharmacy network in and out will be ran for every single claim. So every single paid claim that comes through will be ran against your pharmacy network file to see if it paid at an in versus out of network pharmacy. For transition of care, we have the new members and the current members. You'll see within the first 90 days of the benefit year, those that have a UM reject that has no paid claims in history, and then those that have a paid claims in history. So it's going to test both ways. It'll also test out the GPI function that we have to make sure that if the brand drug is non-formulary, but the generic is on formulary, we get a claim for the brand and there's no paid claims in history, does that member get their transition fill during 2019? For current members, what we'll actually see is there's no paid claims in the look back period. So the cool thing that I want you to take away from the testing scenarios for transition of care for current and new members is that we do have look back logic in place. So it looks at the first 90 days, of course, if they are new members coming in starting 2019 or your current members. However, if you have a member that comes in mid-year, the transition of care module still runs for those members that come on mid-year as new. Few caveats here, which we'll actually talk about as we go into the tool. So for the rejected claims review, we use a brand and generic GPI match. So, you know, your brand and generic drugs, the GPIs are going to match, and the algorithms are based on the GPI. So at times where you may have a brand drug covered, but your generic is not, then it may come back as false positives. However, you will not see those in your results because we'll weed those out before they actually get to published to your client interactive website. Some coding sequences that we'll actually go through when we set you up as a plan. Prior authorization coding, we know different plans and PBMs code these differently. So they may override one UM but not the other. So these are things that we vet out during client setup to minimize these false positives or negatives in your results. So let's enter into the actual client interactive portal so that we can actually see some of the results that come out from the RX Scriptlytics tool. What you will see here is our landing page. So you would actually have your company logo and company name. So where we have Farm Assurance, that would be your actual name. The sidebar list over here has the different list, functions, documents. So here where we have account setup, if you go in there, everything that pertains to the relationship between pharmacy synergistics and you as a client would be stored here. So we'd have our contracts, our contact information for you all, the benefit structure, so how your plans are designed. We can actually also go back and you can put in your input files. So those formulary eligibility files, you're able to load them to the website for us, or some plans like to use their own secure transport where we actually have to go out and pick them up and we'll just take them and save them here. And then we have our output reports folder. So that's where all your reports will go, like your preliminary issues, finding reports, and your performance reports. So the things that you need for your monthly, quarterly, and yearly reports will all be saved here for your easy retrieval. So let's go into the list function, which is actually where we find the auditing results. So what we have here is the rejected claims data. It's going to come up into what we call a quick edit function, and I'll show you how this actually works. So what happens is these columns at the top, this is all customizable. So if you want less columns or you want the columns moved around, we can do that on a client basis. The columns that you'll actually be editing in this function is the client review progress. So if we send you some preliminary errors, then we want to know where you all are in reviewing those. So when we send them to you, they'll be just in review. But once you review them and you confirm it's an error with your PBM, you can actually put confirmed error. If you go back and you realize that it truly was not an error, then it would be confirmed no error. For those, we actually go back and research internally on the system to see what caused it to actually come out into the preliminary issues finding. And then resolved error. So it was confirmed today that it was an error. The PBM fixed it. Member impact and everything was completed. So Thursday you go back in and you put it as resolved error. These are important because that's how our reports are generated. So we'll send you out monthly reports that say how many preliminary issues we sent to you, how many still in review, how many were confirmed, and then all the way into the yearly review, how many have been resolved, etc. These actually feed into our pre-audit issue summary as well. So when you do confirm it's an error, we go in to complete that pre-audit issue summary that you have the ability to send to CMS if you wish. So what you're going to see in this particular spreadsheet that you can actually export to Excel. So say you do not want to have a lot of users to have access to your client interactive portal. What you can do is you can export these spreadsheets to Excel and then take that and send it out to your PBM account manager for research, or anyone internally for that matter that you may be have given the authority to research and fix. So what we'll do is you'll see some of them have appropriate rejects as well as those that are inappropriate. Again, this is something that's customizable. Some clients want to see those that reject it appropriately and inappropriately. Some just want to know the ones that they actually have to do research on. So the first column is the rejected claims module. So that's just checking to see if it was rejected for non-formulary, step therapy, quantity limit, prior authorization required. Was that a legitimate rejection? The second one is the network preliminary reasons. That's the pharmacy reason. So if it rejected as being rejected because it was dispensed at an out-of-network pharmacy, it's ran through that module. And then the transition preliminary reason, this is where the system has identified it as a member who is in their transition period and whether or not that transition field claim was appropriate or not. You will not see it populated for all because that means it would have not necessarily met the criteria. So let's dig into one. So the very first line is for appraisal-am. It rejected for reject code MR, which is non-formulary. The formulary we used did not have appraisal-am on the formulary because it's high-risk indications. So therefore, the reject is appropriate. You see the member PA field is blank, so therefore the member did not have a PA in place, so this reject is appropriate. The transition preliminary reason is blank because our appraisal-am was non-formulary in the prior year, so there was no negative change for this particular member. For the second line item, you'll see that this is actually a reject code 5, which is actually missing an invalid pharmacy number. That's another way of saying that pharmacy, Sandhills Pharmacy, was not in the network, which it was not. So therefore, that particular reject is appropriate, and it tells you the reject is appropriate. If we scoot down to the first of our transition fields, this is for meclizine 25. It rejected again for being non-formulary. This is just giving you a flag that this transition field is appropriate, and that's because it's the beginning of the year. It is a so the meclizine was actually rejected for non-formulary. This particular member, Elmer Fudd, became active with the plan in June of the prior year. Did not have any paid claims for that meclizine, so therefore the tool was able to put that the transition field reject module was ran, and it was appropriate to reject this claim for not being on the formulary. As we keep scrolling down, we'll see one here where this is a new member for pantoprazole. Trying to get 60 for 30. Formulary allows 30 for 30. But the system knew that this member had yet to receive a transition fill of this pantoprazole 60 for 30. So therefore it tells you new member inappropriate reject for QL. So that would be one that we would send to you for you to actually review further. The good thing about this system is, and the way that we actually have the messages written, is we just don't put here TF transition fill inappropriate, and then you got to figure out why it's inappropriate. We try and put enough information in there for you to be able to figure out if it's a new member, a current member, and what that actual reject was for. For this one, we have sumatriptan and also one down here for lorazepam, pretty much same rejections for quantity limit exceeded. These particular QLs, the way they have set up, yes, they did reject for more than the formulary would allow, but they have a PA in place. And for this one, these PAs did mean that this particular member the QL should have been overridden so that they would be able to receive their transition fill. So here, these would be ones that we would send to you and say, hey, the drug is above the QL, but the member has a PA on file. Can somebody look into the coding of the PA to see if this was the original intent? Okay, so this is an overview of what the rejected claims data actually looks like, what the modules look like that they go through, and how your results will actually appear. When we go down to the paid claims data, remember this is where we actually make sure that none of your utilization management edits were circumvented, allowing a claim to pay without the member either being allowed the claim to pay during transition, or because they went through the coverage determination or prior authorization process and received a paid claim. So what we have here is every single claim that comes through that rejected, or that paid, that has some type of tied to it on the formulary is ran through the module. Same format for the most part. Of course, you're not going to see any rejected codes because these claims are all paid. You still have your client review progress window here where you would actually go in and tell us, confirm it if there's an error or not. And what we have here is, so we've got a member trying to get beta seron, requires a prior authorization, but this member has a prior authorization in place, so therefore it came back that it paid appropriately. As you'll notice here, the network filter type, every last one of the claims go through this filter because they are paid, so we want to make sure that the claim that paid was paid at an in-network pharmacy. What you'll see here is network inappropriate. We actually did a pharmacy network that did not have Walgreens in the network. So what happens is this claim paid at a Walgreens, which is not appropriate. So here it says pharmacy is out of network but paid as in network. So that would be one that we would send to you to actually review your setup. Here we've got quetiapine. This drug actually required a prior authorization, but it paid without the member having a prior authorization in place. So therefore, that would be one that we would send to you to actually do further investigation upon. And again, this here can also be exported to an Excel format. So you can export it to Excel and send it out to anybody internally to review. And then that brings us to our pre-audit issue summary. So what happens in the pre-audit issue summary is, again, whenever you confirm that there is an error, we at Pharmacy Synergistics actually go and use the template that CMS has provided, and we put it in a format, and we go out here and we actually populate the portions that we can. Again, remember, this is an interactive tool so that you can go out also and put in things that maybe we don't even do for you. So if you have a CDAG issue that comes up, you can actually add to this particular spreadsheet and actually have it in one concise place for your plan. So for this one, the area impacted was formulary administration. The rosuvastatin was rejected inappropriately as being non-formulary when it was on the formulary. You would come back, tell us numbers of member impacted, or you can complete it yourself. But we would do the preliminary work to start populating this template for you. So what we'll do now is we'll transition back into the actual presentation because just to show you what some of the reporting looks like. So if we found an issue with the claims, we would actually send you an email letting you know that you may want to go and check the portal because potentially we found an error that needs review. So that's our preliminary issues reporting. You would receive an email, and then your next steps would be at the bottom telling you to log into your client portal. You can download it, research it, either confirm it, resolve it, append the error, and then we'll populate the summary logs and reports as appropriate. Monthly reporting, again, some of the things that you'll get is how many claims are reviewed, how many preliminary errors, how many still outstanding, and we'll actually give you an error rate that you can track month over month. And then quarterly reporting, about the same thing, but you'll notice we added the total members impacted for any of the resolved errors. And then yearly reporting goes about the same way. So during the live demo, this would be a time where we actually have questions and answers. But as I stated earlier, if you have any questions, here's our contact information, 803-587-5768 if you would like to give us a phone call, or you can email me at rjones@pharmacysyn.com. Also, you can visit our website at www.pharmacysyn.com for additional information. We want to thank you for taking time out of your day to actually review the demonstration of RX Scriptlytics. Thank you and have a good day.